Rosenburge is a director of the Rosenburge Society for Holistic Health and Education and Center for Ayurvedic Treatment. And he has been involved in the learning of Ayurveda as well as yoga, pranayam, Vastu Shastra, and many other sciences, more involved during the development period of Ayurveda and still hold a major role in the proper application of Ayurveda. He has been trained since 1984 in these, and he has been the director of the Mahendra Yoga Institutes from 1990 to 98, and he is running the foundation of the Rosenburg Ayurvedic Consultation AG in Zurich. He is also involved in many other activities to propagate Ayurveda, not only in Germany, but other parts of the country. And he has been involved as a chairperson at the 3rd and the 4th International Ayurveda Conference at Jamnagar. I call upon him to make his presentation on Germany.
Yes, I'm happy to speak to all of you friends of Ayurveda. Thank you to Dr. Mondika. Thank you to Dr. Vilas Nana inviting me here to speak. Dear Vice Chancellor of this university and dear organizers, I'm happy to talk about the accreditation of Ayurveda and in Germany and the other German-speaking countries. So, to give you an idea, is that Germany, as Dr. Schachringer has pointed out, is maybe one of the countries in Europe where the awareness on Ayurveda is high. In Switzerland, in Austria, it is the same. Since years, there's a huge demand on Ayurveda from the public. Now, when it comes to the question what kind of institutions are there, then we heard from Dr. Schachinger that there are different kind of associations and institutions. On the one side, there are cure programs, treatment programs, medical associations. On the other side, a huge number of, we would say, treatment programs on the wellness level. To make it clear, in my point of view, there are 4 levels of profession in Ayurveda. Those are now common in Germany, in Austria, and in Switzerland. The first level is the level of medical doctors. Means that medical doctors using Ayurveda as a complementary medicine, or if they are really gone through long studies, they also maybe choose to use Ayurveda as their main therapy. But normally, if doctors, medical doctors, are getting interest into Ayurveda, they're getting their interest in using Ayurveda as a complementary part of their therapy. Secondly, there is a second level profession. In Germany, they are called Heil practitioners. In Switzerland, it is the same. In Austria, this is not existing, but it is a second level of medical professionals, persons who have the accreditation and the license to heal. In our academy, we have trained about 200 of these medical professionals, and on top, another 70 medical doctors on a postgraduate training. Now we are coming to the 3rd professional group. It is the group of physiotherapists and nutritionists and nurses. Those are members of the medical group, professional group, and for them also we had designed training because we found this is a backbone for a doctor. If they have good professional persons, those are trained in the field of Panchakarma assistants, as you would call it, or as we call it, therapists. Now we are coming to the 4th professional group. These are lay people. People, those are not in your age. These are people, well, sorry to say that, I don't see really the old age of you, but I want to say is these are not young people. These are not young students. These are students of the age of 30, 40, 50. All the people I talked about, they are of older age. Now, these people are therapists on the massage level, on the wellness level. They are lay people. They have not any medical education. And the demand from that people getting into Ayurveda is huge, since they have the feeling there's the richness of Ayurveda I can get through this kind of trainings. And by the side, I can give massage to other people. I maybe can work in a hotel, and I maybe can add this to my beauty palace or whatsoever. Now, what is important is that on the first and the second level and the third level, that these groups get be strengthened. That is one of the main aims of our academy, the European Academy of Ayurveda. It is situated near Frankfurt. We have an own building with a lot of facilities, and especially an own Ayurvedic kitchen, which I found is very important to transport Ayurveda as a holistic medicine. When it comes to the question of accreditation, then I would say accreditation is not accreditation. There is accreditation on the government level, on the level of the medical associations, on the level of the universities, on the insurance companies, on the public, and on the media. We have to differentiate between these different levels where accreditation should happen and can happen, and also has happened. Now let me go a little bit closer to that. On the government level, as we all heard, it is not easy to find people, those are really stakeholders for Ayurveda, going forward saying, well, now we want to establish Ayurveda in our country as a unique own medical system. For Germany, Austria, Switzerland, I would say it will take a lot of years until this would happen. But on the level as a complementary medicine, to use Ayurveda as playing an important role on the complementary medicines, they are open for it now. Secondly, the medical associations. The medical associations is, from my point of view, the most important association and the most difficult association to get accreditation from. Now, there is few steps that has been taken there. Dr. Schachringer told that there are 2 academies in Germany that have got accreditation. This means getting points so that the doctors who has undergone a further training program, they get some points when they undergo a training in Ayurveda. This doesn't mean accreditation. It only means that at least there's awareness of Ayurveda on the scientific level. And I found this is a very important first step. Same in Austria. Our academy now is training medical doctors also there. 20 doctors are now on this training. And we're getting accreditation on the same level. Plus, we are now putting a paper to the medical association asking for getting the diploma status of Ayurveda. This would mean the insurance companies would pay. And if this will happen, this would be a very, very good step for the whole Europe. And I hope that we can get through the program that we have offered together in cooperation with a medical society in Austria. Now, coming to the universities, on that level also, Ayurveda is really weak in all countries of the German-speaking Europe. There are only very few universities now beginning to offer some Ayurvedic trainings, or, well, just asking for a talk on Ayurveda, maybe for 1 hour or 2 hours. I know through our contacts that there is a Jena University, they have started now with the at least 10-hour program on Ayurveda for young students that want to learn holistic medicine. And this I've also found is a very important step, and I think it will go on in Germany. The insurance companies, there is a private insurance companies in Germany, they are paying Ayurveda here and there, but the normal government insurance companies are not willing to pay any Ayurveda treatments up to now. There's an exception in Switzerland. In Switzerland, there are all the therapists, those also we have trained, and the doctors there, they're getting through a side program by the insurance companies, the patients getting money back. So in Switzerland, we have a really nice situation in the moment now. The accreditation in the public is high. We can say that accreditation in the public is there. On the media, half-half. On the level of wellness, also medical wellness, it is there. On the level of medicine, it's coming up more and more that also the media is interested in writing on that level. To make it short, what do we need in Germany to establish Ayurveda more and more? I would say that we would need a strong voice for Ayurveda in Europe. And Yes, I think you all clapped and you supported us that there should be a European platform for Ayurveda that has been founded yesterday evening. Also, there are other associations in Germany, in Switzerland. They all have done something. I'm involved in one association, has 600 members on Ayurveda. They are doing a lot. They're trying much to get onwards with the regulation of a standard education and quality management. But I think that it is important to make a differentiation between, on one side, the medical field, the medical doctors, also the field of research, and on the other hand, the second-level therapists and the nutritionists, the lay people, those do wellness. We cannot mix them up all in one association. It is better to have two, one on the scientific professional level and the other on the therapeutic holistic level, and combine them, let them work together, since the medical association, which is the most important association to address, they are more open to speak with the medical people themselves, and they do not want to be, get in connection with the whole field of Ayurveda, since they think Ayurveda still is involved with the field of wellness very much. What we also need is a good picture of Ayurveda in India. This would strengthen the whole position in Europe very much. And if you'd like to help us in this, I would suggest that India should come together, discuss how they want to promote Ayurveda on the touristic point of view and on the medicinal point of view. In the moment, it's going just, mixed up. There are so many offers in Kerala, people are going there, and the people from Europe, they don't know, are they really getting medicine now, or are they getting wellness? They are not sure. Because how it is promoted doesn't make clear what Ayurveda does offer in the institution. Those are now on the market everywhere in India. And there are so really good institutions, but in clinics and resorts, but they do not make clear on what level they are offering Ayurveda. And I think it is very important also for us as Europeans to have a clearness from India that there is a differentiation, like a quality seal on the one hand on the level of wellness, maybe a medical level of wellness, and on the other hand on the medical clinical level. Since I have made the experience, and I hope you, like me to speak about that, is that we saw that people from Germany, from Austria, from Switzerland, they went to India, they're coming back, they had a 2-week Panchakarma training, but they're coming back to Germany, then they get a cold, they were weak after that. And they haven't got a good Panchakarma treatment in India itself, because the institution there was not sure whether this person wants to undergo a real medical treatment program, or if the patient wants to have a little bit more wellness. So then in the beginning, the Indian doctors say, well, you have to stay in the resort because we want to do real Panchakarma. Then the tourists say, well, we want to go outside, we want to have sightseeing, we want to go to the ocean, we want to enjoy also. Then they say, okay, you can go maybe 1 day. Then they say, okay, you can go 2 days. Then what you see, it all gets mixed up at the end. And this doesn't give a good picture from Ayurveda at the European countries. I was asked from the government of India to promote Ayurveda at the International Book Fair of Frankfurt, since we were known as one of the best institutes in Europe. We were there, we were presenting Ayurveda in connection with Ayush, Department of Ayush. It was a wonderful possibility. On the one hand, also, person from the government of India said, well, you have to promote Ayurveda real as medicine. Don't do so much wellness, because they know we also have this section of therapy and wellness in our institute. I said, yes, okay, we do that on a professional level because this is also our target. But then 5 minutes later they said, well, please take these posters from Kerala Tourism and please put them on the front of your stall. See, isn't that a contradiction? So please, if you want to do something in India, make these things clear. Both things are great. Ayurveda for tourism is super. Ayurveda for medicine is also great. But don't mix it up. There should be the Minister of Tourism, the Minister of Health. They should come together and they should make clear what is our section, what is the other section, so they can support each other, but it is important to make a separation and to have a quality seal so that also people from Europe know what they will get when they are going to India. And another point is that if Pune University wants to help us, then I would suggest is that support all the students from the university, that they successfully can use Ayurveda, can practice Ayurveda. As far as I know, there are more than 50% of Ayurveda doctors coming from the BAMS training program. Those at the end are not doing Ayurveda, they are doing allopathic medicine. So, this is not a good picture for Europe. When our Europe government is going closer and wants to know more about what is really going on in India, then this is not a good picture that India is showing us. So please do the ever best you can to put the BMS students into the strengths and the possibility to really practice Ayurveda as a full holistic medicine. And I want to address to you students, please go into the depths of Ayurveda. Go into the depths of Ayurveda. Think and be proud of this system. And really, you can use maybe allopathic medicine as a side program, but the core of your treatment should be Ayurveda. Don't make any compromises in that, because at the end you will be the winner. Ayurveda will come up, but it needs the strong persons from India. Those are really getting into Ayurveda. There are so great scholars from India here, all in this forum and everywhere else. Use the contact, go deeply into it, and the university should support these students really to also professionally get into the situation of success with Ayurveda in your own country. Then also what the university could do is support in the research level. What I want to say is that there's a lot of researches done on the field of plants. There is taken one plant, Ayurvedic plant, and there has been done research out of it. How does it work? And we know that there are many researchers on that level made in India. But what we need, if we want to discuss with the medical associations in Germany, we need research papers. Those are holistically, means those papers should show Ayurveda as a multimodal system, as a system that has a lot of aspects, not only the herbal part. It has different aspects. As we know, there is the part of Panchkarma, the cleaning part, the Shodhana part. There is the part of nutrition, there's the part of lifestyle. And all this has to be combined. I know it is not easy to work out a research on that, but this has to be done. Bring it together. You are the university, you can do that, because this is what has to be shown to Europe. It doesn't have to be shown that this herb works, because maybe it is an Ayurvedic herb, but at the end, sorry to say that, it's just a wonderful herb in our earth. And it's only in the Ayurvedic books, but that's all. It's not Ayurveda at the end. Yes, please, university, go for that. And I think that, yes, one thing that is important for me to say is that the holistic part of Ayurveda should be strengthened. I have a little fear that maybe with Ayurveda the same thing can happen as with the Chinese medicine, that only a part of it will be taken out and will be accredited, like the acupuncture. No doubt, acupuncture is a great system, but we know that the traditional system of Chinese medicine is much huger. And the same with Ayurveda. We should not take out any part of it and maybe finding a fast way to get accreditation for that. We should always try to get accreditation and acknowledgement for the full holistic system of medicine, which is a rich system that India has brought to the world. And I want to thank you, all of you, that I could spend some time with you. Thank you very much.